Your knees hurt, don't they? Of course they do. That's why you're watching this video. I'm sure you'd have better things to do with your time than to scroll the internet looking for videos on how to fix your knee pain. Well, I was just like you. Believe it or not, I did something stupid in the gym and injured my right knee. And I suffered for months with knee swelling. I could barely walk. I couldn't bend my knee. And I will show you the exact movement / exercise that I use to rehab my knee, get it bending fully, and never to return again. So over my 25-year career, I see a whole bunch of knee injuries and knee pain that come through my clinic every single year. And unfortunately, a lot of them could have been prevented with good, healthy habits regarding their knee health and keeping the joints strong and stable. You know, over 700,000 knee replacement surgeries occur in the United States every year. A lot of these could be prevented. And we're going to show you the blueprint on how to do that, how to avoid surgery, keeping your knees healthy so you never ever have to worry about age-related degeneration and having to visit the doctor talking about surgery. Okay, so here's the one and only exercise or movement that you'll need to fix your knees once and for all. You need to be able to get on the floor on all fours and rock back slowly into the point of restriction, right? So wherever that knee starts to get more painful or tight, you stop there and come back off. Eventually, over time, you'll be able to sit back on your heels like that. And once you can do that, that is now causing compression in the knee, solving and healing the connective tissue, the ligaments and the tendons, allowing them to stretch properly. The problem with a lot of people is when their knee hurts, they avoid that range of motion. And if you don't use the range of motion, you're going to lose it, and that's how degeneration begins. So instead of taking pain medicine or getting cortisone injections, you need to slowly and patiently push the knee into the very point that it doesn't want to go and then back off. Now, it's not going to be smooth and steady in the beginning, especially if you're like me and your knee is swollen or you have joint effusion. You have to be careful and be patient and just work the range of motion that it gives you. Once you start to break through the barriers, you'll be able to comfortably sit back on your heels. And that's step one. That will take care of any sort of acute to subacute knee problem that you may be having. So trust me, guys, this one is the go-to. This will also help you stretch your foot and ankle. All right, so if you get on your toes like that, you can stretch out your bottom of your feet, or if you have plantar fasciitis, and increase the mobility of your ankles, because that's where the problem comes into with squatting and knee health. If you need to be able to perform these functional squats like the Asian squat, which predicts longevity, then you have to start here. You have to be able to get the knee to accept compression and start the rehab process. Then you can work into functional squats at home, body weight squats, where you're just coming down to 90 degrees, working down slowly. Now, if this becomes an issue, you could also use a ball. So grab a ball, and that'll help you sitting back on that ball so you can rest in that comfortable position right at the point of restriction rather than trying to hold it there. So grab a ball. A bigger size ball will limit the range of motion, all right? And then you slowly progress down to smaller balls, and then eventually you remove the ball and you'll be able to sit back on your heels. So trust me, guys, this one exercise will get rid of your knee pain if you do it every day in weeks to months, depending on how severe the knee injury is. And now, once you've accomplished that, you're going to want to get your legs stronger. And we'll go over a series of different exercises, both for strength and function, and progressions of those exercises that will keep your knees healthy for a long, long time. So the Asian squat is a functional test that I have many of my clients go through when they come in with knee problems, as long as their knees are not too stiff and not too painful. The Asian squat is a great predictor of longevity, functional strength, and overall stability and mobility of all the joints in the lower body. So the goblet squat is one of the best squats that produces both function and strength. So you can keep your feet in narrow like that, squatting down like that, or you can widen them, pointing the toes out and coming into a deeper squat like that. This is going to provide both function and strength for the knees. You could elevate your heels up off the ground. This is one of the best ways to get rid of patellar tendonitis and to put a lot of emphasis on the quads. So if you're having frontal knee pain, patellar tendonitis or jumper's knee, you can elevate the heels and try some of those to get your knees strong and healthy. So one squat variation that gets overlooked a lot is the sissy squat. Getting your knees up over your toes, elevating your heels, really emphasizes the quadriceps and will bulletproof those knees, helping with compressive forces to heal any connective tissue and strengthen the ligaments and tendons around that knee, which will help in keeping the knees healthy as you move through your functional activities during the day, whether it be hiking, sports, or in the gym, lifting heavy. This movement here is probably one of the best movements that you can do at home or in the gym as a warm-up to keep those knees healthy. So if you give those two a try, those alone will help to keep those knees healthy and strong for years to come. So remember guys, if you can't get into this position comfortably and stay here with stability, then you have a knee problem that needs to be addressed. And if you don't address it, the longer that time goes on, the more and more the problem is going to manifest into something that potentially a lot of these exercises that we went over won't be able to help. And you will have to see the surgeon and have a surgery that you won't be able to recover from. So take it from me, if you cannot do this movement or be in this position comfortably, then you need to get with that program that we just went over and rehab and get your knees healthy so that way you can live a long, healthy life. Okay guys, thanks for watching, and remember to stay tuned for the next one and subscribe to the channel if you thought that this was helpful. And remember, take care of your knees so they will take care of you.